Hi, everyone. Stuart Gandolf here. Welcome to another podcast. Today we have Susan Boydell, whom you may have heard about 6 months ago. We were bringing her back today for some special work. Susan is a principal with Barlow McCarthy, and she does a whole lot in the world of building doctor referrals. Welcome, Susan.
Thank you, Stuart. It's good to be back. I'm going to enjoy our conversation today.
We always do. So today, what we're going to be talking about is how to build doctor referrals to multi-location practices. And there's been a lot of changes today. And a lot of times when we think about the world of building doctor referrals, and particularly for providers like hospitals and health systems, is really where people are thinking. So first of all, let's actually, why don't we go back a step? And Susan, tell us about your business, maybe what you've done, and then how it's kind of evolving today.
Well, just like you said, and this is our topic, it's one of our favorite topics, but we specialize in this space of referral growth. And like you said, we do a lot of work, likely you would understand that, in the hospital health system space. But this space of large multi-location groups, practices, we'll talk about that here in a second, but there's a lot more going on in that space, which says a lot about what's happening in the market. So our piece in referral development is if you just think about how you help organizations, whether it's a hospital health system, large practices, sustained growth and what that means to their bottom line and what they can do and how we do that. So if you just take the word referral, linking physicians and their patients to the care that they need. And sometimes that's the simple part of this because we all get referrals, but sometimes it's like, you got to link them up. You got to make that piece happen. And this is the piece that connects it to that sustainability. So that's a good idea for a background.
Very good. And so one of the things that caught my ears when we were speaking recently, because again, this world of, and just for some of you that may be new to this topic with my blog or podcast, I remember about 10 years ago, somebody from the Wall Street Journal reached out to me and said, I can't believe that there's these people out there that go out and build referrals for hospitals. I'm like, yeah, it's called physician liaisons. And like, we're covering this because we just had no idea that hospitals are spending money on this kind of thing. And I flew out and met her at a conference, and it was just this most amazement they had. And it showed up in Smart Money magazine within the Wall Street Journal. And it's like they just had no idea. And you and Chris and others really pioneered this world of building. The term we use for them could be a lot of things. And addiction, they talk about business development. Sometimes we'll call them practice reps. I think I settled on the same term you guys use, which is physician liaisons. But somebody who goes out and builds doctor referrals on a face-to-face basis. And typically it was for hospitals. And oh, by the way, just as we're getting started here, for those of you that are new to this topic, I don't know of any other world where business is done where you just drop by. Like still, it's like only in I'm sure there's others, but I can only think of healthcare where doctors actively discourage setting appointments, encourage stopping by. So it's kind of like the way this has evolved over the years. And so everybody's familiar with drug reps dropping by to build referrals or sell doctors on, how they're going to prescribe. But, hospitals, this was nascent. You guys sort of, helped build that category. But today's topic is not so much about hospitals and health systems, it's about private practices and but larger ones. And so I would multi-location, typically specialty practices, but tell me more, like what kinds of calls are you getting these days and from whom and what about?
Yeah, well, it's a little bit of a change of the market because even your piece where you say, and I think I remember that Wall Street Journal article probably as well.
Yeah, yeah,
But even when you think about the just dropping by, that's changing. That
yeah.
is really changing. Because boy, everybody wants a piece of a primary care's business.
I think.
Because they're everybody does. Hospitals do, specialists do. Everybody knows that, well, it all starts right there. But that's only one piece of it. But this whole space and this multi-location piece, it's an interesting one that I would say, we've been talking for a long time about the I'm going to say consolidation of hospitals and health systems. Okay, merging, you know, they're getting bigger. You just hear, you don't maybe hear quite as many of them because there's been so much of it. But, you know, for a long time, that's really what it was. Now let's think about it. Well, now it's in the space of these specialty practices. And you sort of get it, because why did health systems do it? Well, I can save a lot of money if I take all of my expenses and I try to make that happen across consistently across multiple locations versus an individual hospital. I can negotiate better rates because I have a bigger marketplace than otherwise. So you can take the same thing and sort of put it in this multi-location practice. And so we've actually seen the same thing where, and it's mostly like whether it's very large orthopedic groups that have gotten together. Multi-location doesn't, it can mean multi-location within a geographic area, but a lot of times it's like, okay, we have offices in you know, Georgia and Denver and other place, like, so it's all of that. And you sort of get it. So then when you think about that piece, you go, so how do you grow business and how do you do that when they're not all in the same geographic or marketplace? There are multiple marketplaces, but you're delivering a service across the board. So, and it's all about lifting how well that organization does as a whole, no matter where their locations are. So, a little
All
bit.
right, so let's talk about that a little bit more. So when we were talking offline prior to the podcast today, we were talking about, you know, who's reaching out these days. And in my experience working with private equity, and of course, you know, we Healthcare Success, we're an agency, but and also again for people who might be newer to us, you know, when we talk about marketing, we're not just talking about consumer direct. A lot of what we do is consumer direct, but we're also always thinking about things like patient experience and doctor referrals, which most agencies just doesn't make their radar. And that's why, you know, I refer to Susan and her team for, you know, fairly often. A lot of referral times we get prospective clients that aren't really a fit for what we do, or in conjunction with what we do, we, you know, bring in Susan and Chris and other people on the team over there. But to help you understand if you're or what we're seeing these days on our end, as well as Susan is seeing, is, you know, oftentimes there's private equity behind these multi-location businesses. Sometimes they're doctor-owned, more frequently private equity. The person who makes these decisions at this level, usually not doing the work. The CEO could be driving this, the CFO, COO, sometimes marketing, but a lot of times it's different executives that are really looking to boost revenue. And I often speak at, you know, private equity conferences or, you know, other kinds of venues. I talk about marketing as a misunderstood lever that could really grow a business. And like yesterday, Susan was talking to an urgent care chain about how much the paid search is driving growth for their business. And most people don't think about that when it talks that, you know, private equity takes over you know, a business. They're looking at cost cutting and they're looking at revenue cycle management, a lot of smart things, but they often underestimate marketing. And I think this is another category. Doctor referral bidding is such a driver. So many of these businesses might be, you know, 50%, 75%, 80% or more doctor referral driven. And the idea of, geez, can we grow our doctor referrals purposefully seems like a good idea. So I'd love to hear more about that from you. I'm doing all the talking right now, unintentionally, but what kinds of things are people telling you when they reach out to you and that you're helping with?
Well, it's exactly what you said. They need to grow their business and they know to grow to get their, I'm going to say these are specialists, okay, to get them busier. It means I need to give them more referrals. Absolutely, the consumer plays into this. I love your patient experience piece because we will tell you that referring physicians, if they hear from their patient that they did not have a good experience with that specialist, they will think twice before making that referral again. So that piece even plays into all of it. But growing business at the referral level, it's exactly that. I need them to think when they have that patient with a specific need that they need to then refer them on to a specialist to take care of that, that where that referral is going to go. And what's not any different than it ever has been before, it's just harder today, is that everybody wants that same referral. Okay. If they didn't, like if you said, well, if you got no competition, you're great. But there's probably not hardly anybody. They can say there's no competition in this. So the whole piece, even in your world, Stuart, about what's different, why them? Why should I send here when I've been sending over there forever and I'm happy about that? Why would I switch? And you know, one of the things we see that you probably see similar in your space too, but I'm going to guess that a lot of, like you were talking about, the you know, the CEOs in these large practices and all of this, when they think about growth, they know their market. And I will tell you one thing that has happened over the last 12 months, I'm going to say 24 months for sure, is highly aligned markets. So it used to be that primary care physicians or those referring physicians, because in the specialty world, it's not just primary care, because there are other specialty practices that can also send you referrals depending on what it is you're looking to grow. But when you think about that piece of it, they would sometimes send to multiple different, like depending on what the need was and who was available, the relationship they had. Well, that's all very tightened up. And so when you think about how hard it is now to change a referral pattern, it's not as simple as like, well, let me just go in and have a stop by and go in and have a conversation with you. It is much harder and much deeper. And it also tells us about the talent that you need in the field to be able to do that, because what was done even 5 years ago probably won't work today. And that's the biggest thing that I would say we're seeing is different, is that the strategy still works, but how we look at it and how we deploy it, there's a lot of different levers to that than what there were before.
So we were talking to a large specialty practice that just had a health system change, and so now a lot of the referring doctors that they were able to get before have just stopped, and so there's they may be sort of legally allowed to refer out the side of their system, but it's really highly discouraged. So I'm assuming that's what you're referring to here, because as health systems, it kind of becomes tribes now. It used to be everybody for themselves, everybody was independent, but now, so often they're either affiliated with a hospital system, maybe an IPA or whatever. What are you finding there? Like, is that the challenge? And if it is, like, what are some of the ways to, try to start penetrating that?
Yeah, I would say that's exactly the challenge. So yes, everybody wants to keep everything in network. So, and if you think about it from, oftentimes we've used the word leakage. Okay, so I had that patient in my hand, but they needed to go have different things done. It could be as simple as imaging. It could be as simple as, if it's like, let's say it's for a, breast cancer diagnosis, they're going for a biopsy. Depending on where all those things happen, I could lose the patient. Okay. And I usually want them from a hospital and health system perspective. I want the procedure. Okay. Because that's what helps their bottom line. So let's go to the multi-specialty practice side of this. Depending on how you're aligned with those hospitals and health systems, they can direct to you or direct away from you. The same thing can happen in the insurance world. If you are considered high cost, maybe your outcomes aren't at the level that you want, perhaps there are some other outcomes that you don't deliver at the level that they want, guess what? They bypass you. They influence where those referrals are going to be made. We hear so much about, this could be a whole nother blog on itself or podcast on itself, in this whole world of value-based care. All of that sits in there. So the strategy from a multi-location specialty practices, I got to understand how all of that ecosystem works. And I better make sure that what I've got is differentiated and meets those needs, because otherwise I won't get those referrals, because they're going to automatically go somewhere else. So it's understanding that ecosystem, which is where data comes in, all of it, that just makes the whole thing so much more sophisticated than just, do I have really good talent in the field to go have these conversations? I got to know a lot beforehand to be able to say, okay, let me direct my talent to these practices where I know I can earn something, and make sure that they have the skill set and the knowledge to be able to influence where that referral goes when the time is right.
So when you have health systems, employed physicians within a health system are going to probably refer to employed system in another health system. But when you have a practice group, I'm guessing a lot of the people you're talking to are trying to be Switzerland to be able to work with both health systems or, all three health systems in an area. Or are you finding even then some of the health systems are really trying to refer to doctors that are captive, either directly employed or heavily affiliated? Is that what's going on? And and I also like to know, is that on a doctor by doctor basis, or is it like the whole practice? Like, how does that work in the real world in your experience?
Well, and again, it depends on how these large groups are organized. But there are affiliations and partnerships with health systems that can then drive that volume. The they have to do, let's just take an orthopod, for example. Okay, let's just use that because it's like they have to have somewhere to do their surgeries. So either they have their own facility that they do their surgeries in, and you're after those referrals to drive that business to your own surgery center, or you are partnering for maybe that's outpatient and all you're inpatient for those things that need to be done inpatient. Well, where am I doing those? Who am I partnering with? Those relationships can drive sometimes where those referrals go. So if you look at the ecosystem again, you can see oftentimes through data who's aligned with whom and where do I have an opportunity to earn away. Sometimes anymore, it can be, well, I'm not going to get all of their, I'm going to say, all their orthopedic referrals from this group of primary cares, okay? But I can niche this because I'm differentiated. So I should get all of these because they don't do that as well. They don't have access as much. Whatever it might be, access is a big thing right now.
I want to
So
come back to
using
access
that
in a
as an
moment.
example, but
Yeah,
yeah.
I want to come back to that in a moment. Um, Another question that occurs to me and it's fun, I've been doing this for a long time, so hearing this side of it more in detail is just fun for me to, learn and catch up with what's going on for you guys. Another question I have is traditionally, a physician liaison with somebody, and we'll talk about what makes a good physician in a minute, liaison. We've talked about that before, but we should come back to that again in a minute. But it really was somebody who could generate relationships with referring doctors on sort of a doctor by doctor basis. And back in the old days, you had a bunch of individual doctors, and even you had a group of three or four doctors. Each doctor was their own prospect, right? Like
Yeah.
they had their own relationship. So one doctor within the same group may refer to a different doctor than somebody else within the same group, right? So it was a very one-on-one basis. I'm assuming there's still an element of that, but what about like sort of on a partnership level with a multi-location business in the hospital? That's a different kind of thing. And, as a physician liaison, helping set those meetings with the CEO, or how does that work? If you're trying to go less on a one-on-one, one-to-one basis, this doctor with that doctor, but more system-wide, do you get involved with that? And then how does that work? Is it the same thing? Like you're kind of doing both at the same time?
Well, so it depends on what I want on the back end of it. Um, just using your example. Um, so if I'm trying to earn referrals from, let's say, a large primary care practice, yes, I'm probably going to start at the data side and say, okay, let me see who we might have an opportunity to earn referrals from. Like, I'll give you an example this still happens a lot today, okay? Is in a large primary care practice, they might play Switzerland. Okay, let's say they're independent of some sort. There's not very many of those, but let's just say it. Where it's like, okay, so
Right
they all
right
these
next to
referrals.
right next to the Sasquatch and the Loch Ness monster. Talking a lot, but hard to find.
Yeah. But in terms of where their alliances are and where their business goes, because there might be some physicians that are, I'm going to say, assigned to you work with this health system or these providers. I mean, you just got to kind of know that piece and where they go. So there is some individuality to it today, but you kind of almost have to step back to be able to see, well, where is my opportunity to grow? Like if I'm thinking about a multi-location practice and I'm trying to grow my specialists, okay, where my specialists do business is going to help drive some of that. So if I'm doing my business at a competitor my likelihood of getting referrals from their primary care physicians is going to need to be, I'm going to need to be differentiated. I'm going to have to figure out what's in it for them to make that referral. It might mean, well, do I need to do some of my procedures at their facility? I don't know. I'm being general now. But all of that, it's like who's getting what out of it that sort of drives it. Does that make sense?
Yeah, I think that it sounds to me is just it's super custom by business you're working with, right? Like
Yes.
you have to think through, and you said something a couple times that I haven't emphasized enough is data. It's funny, a lot of even reasonably sophisticated businesses aren't familiar with just how good the data is and how much you can get data to see, what procedures they're doing, what they're diagnosing, what drugs they're giving out. So this data is out there. And so you can certainly figure out the 80/20 rule, which doctors are referring most to the orthopedic surgeries, for example, or which groups or which individuals or whatever. So starting there is a lot better than just knocking on doors randomly. It's like not like there is a yellow pages anymore. At least I don't think there is, but it's like, you're not going at the beginning of the yellow pages, starting with A and going down to Z. You're focused more on, okay, understanding the marketplace is a really important thing. Like, where might the opportunities be? And I'm assuming when you're consulting with people, that's probably where you start. Um, so with the database analysis approach and looking at the opportunities, like who's out there, who's referring, who are they affiliated with, trying to decide who is the right prospect at the sort of larger business level versus the individual doctor level. Um, but let's talk about like who's doing this. Okay, so this is my former roommate and I used to have a joke about our lazier, messier roommate. We're like, hey, elves don't clean up after you. I clean up after you. So in this case, it's been a while since I've had roommates. But the elves don't go out and get doctor referrals. And so those are typically people who are paid to do that, solely that. We've commiserated for years about like, yeah, then they give them brochures to do and fill out this paperwork and all this other stuff that's in the middle. But a true physician liaison goes out and builds relationships. So in this much harder world today, what is what are the qualifications, salary level you see? Like, because the temptation I see over and over again is to send somebody out who drops off bagels. So like what works in terms of the kinds of people you find for to actually do this kind of work?
Yeah, it's a really good question because I would say it's an evolution um, that we're still in because yep, the taking donuts doesn't work.
Yeah.
And that's been around for a while, okay? But just like we were talking about before, everybody wants time of the primary care physician. Everybody wants their time, including research people who say, "Oh, I need to understand what primary care physicians think." You
Oh,
know,
it's much worse than that. It's yeah, because it's real estate salespeople, jewelers, car dealers, insurance sales guys, financial planners. Everybody has this.
everybody wants their time. So let's just think about the like what it used to look like, and data drove this too. Okay. So when teams would look at, okay, where does my team need to focus? Who are my targets that I have the greatest opportunity to earn referrals from? And majority of the time when you looked at data, the bucket that you loved the most was the group of splitters, as we call them. Okay, it's like that meant they gave some to me, but they gave some to the competition too. So if I could just move a little bit more my way, because they already use me, I should grow business. And they did. Okay, that's how that works. When you look at the data today, that bucket has gotten really small for all the reasons I just told you. The alignment is so much tighter. They're either highly aligned with the competitor, highly aligned with you, and then there's this bucket in the middle that you go, if I just focused on that, I'm probably not going to hit my goals, which means now I have to go after that business that is aligned more with the competitor, which means my conversations are very pinpointed on what business, what referral can I earn away. So I have to understand better what we're differentiated in, what makes why that would be much better. I almost have to have from a talent perspective, a little more clinical insight. I was just having a conversation a couple weeks ago. This was with the health system leader, and her last couple hires had been clinical. Now, we will tell you, you don't need to be clinical. You don't need to be a nurse, because I'll tell you, most nurses don't really have selling skills. So that's a tough one to find that can do both. But they have hired people with more clinical background and have seen a considerable shift in effectiveness because of that. I get it. Because what we're asking them to do is have a more clinical conversation about what a patient would present with, when would be the right time that referral needs to happen, and why your specialist versus somebody else's. So that to me is the big thing from a talent perspective. And because I said data, I'm going to tell you, there's most salespeople are not data gurus. And not that we need them to be data gurus, but when I think about large practice, multi-location practices in these larger groups, it's not like they got data people all over the organization. They do not, which means as a salesperson, that person that's going to go out and grow some business, I got to have some insight in how I look at that data to determine where's my greatest opportunity, because that your time is precious, because they cost more. So everything I'm telling you right now, you're going to have to pay them more, which is the tough part in most organizations, is switching that and finding the talent that can do it.
So, in terms of numbers, I know every city's, it's going to be very different in Topeka, Kansas versus Los Angeles, but you're talking probably what, 80,000, 100,000 plus for a lot of these markets for sure, right? You're not going to find somebody for minimum wage to go out and be effective at this.
No, no. And here's a lot more conversation about how incentive programs work, okay? Because it's like you said, they build relationships, but it's relationships with intent. So I'm looking for, when your patient needs something, I want to make the connection to my specialist for the services that your patient needs. So these are sales skills. So incentive plays into it. We talk a lot with a lot of teams, mostly health system teams, I would tell you, but it more and more in this multi-specialty space. That if there's true opportunity to grow business, incentivize them. Have a portion of that, but it's got to be enough to incentivize, not enough for them to go, well, that was nice, thank you. It's got to incentivize. So there's a lot of work still in that space that's in addition to what maybe that base salary might be.
Yeah, and that's again one of the key issues that um, we talk about a lot. Like if we'll come back to, well, I'll do it now. So we don't have to answer everything right now, but some of the questions is, with your business, you guys consult with people and help them figure all this stuff out. But there's a lot of issues. If you, first of all, if I were looking at this as top of mind, and I was thinking like, oh, I really want to build doctor referrals, Susan. Yeah, okay. First of all, who leads the effort? Like that's different than the person on the ground. Do I do a beta test with that person? But is the person that's good at doing this, good at managing people? I'm not sure I know that answer. Probably not usually. How do I compensate? Well, first of all, how do I recruit people? How do I write a job description? How do I compensate them? How do I manage them day to day? How do I hold them accountable to results? How do I make sure they're doing what they're supposed to be doing? Like that's a lot, right? Manage them on a day-to-day basis. So I'm assuming these are the things that come up for you every day, right? Like, when you're out consulting with folks.
Yeah, every day. And I will tell you though, especially in this multi-location, multi-specialty space, because I'm going to say it's newer. Most hospitals and health systems have some form of a referral development field team.
Yeah,
They
it's
have,
come a long way. It's been going on for what, 20 years probably or more.
yes. So
So
they've got
it's
something they've been doing.
glacial, but it's pretty saturated now.
Yes. Yes, they might come to us and say, oh, I need to make sure we're performing at the top of our level. But when it comes to these others, sometimes they have some people, but it's not a really strategic approach to how they put that together. And then when they start to expand and grow by bringing on more practices, which is what drives the growth need, is, okay, now I'm bringing on more. I need to make sure that they are getting busy. And so that whole piece of, like, sometimes we've done pilots. It's like, okay, let's go look, because sometimes they don't even have the data to be able to tell you, well, what's the opportunity, which is what drives the resource count. Like, well, do I need a liaison? Well, data would tell you if you need a liaison, because you got to know how much referral opportunity you've got in a market. And there's ways to do that even when there's not data. But we do a lot of pilots, not a ton, but it's a good way to start to say, let's put somebody out, let's put a strategy, best practice strategy together, and let's see what results we get. Based on that, we always in our minds say, how can we scale? So as they grow, can we scale it? Can we expand it up? Even if it means I'm going completely into a different state, into a different geographic area, how do I expand that same thing as I bring on practices? Because usually the first time you do it, it takes longer. When you
Yeah.
start to then move, yeah, you get it. That it's like, okay, now I can move quickly. When I move into new markets, I have a plan for how I move into a market. How I determine what resources I need. Who am I going after? What do I have my tracking and reporting in place? I mean, you mentioned that. Like, how do I even know they made a difference? Well, it's kind of foundational. Like, you want to be able to do that. Like, I want to be able to see, are we getting the referrals based on this strategy and the money we're spending for that resource? Because the resources, like you said, they're not cheap. So I
Yeah.
got to deliver. Yeah.
Well, also, like, a lot of these, if it's private equity on, they may have 5 to 7 years from the time they buy this business that they want to sell it again. So that's not a very long time if you've got 150 locations and you're
Yeah.
just getting started, right? Like that's a lot of scaling, a lot of people, a lot of coordination. And we've talked about this in other calls, but even when you start putting people, like in a marketplace, and as you get bigger, it gets more complex, obviously. But like if you think about, all right, in some marketplaces, you may have enough locations that you need 2 or 3 reps just to cover Atlanta, for example, whatever. Maybe you have 10 or 15 locations. I don't know what the numbers are, how that breaks out, but you're going to see regional. Other times you may have somebody for a whole state, or you may have like lots of people, it's all clustered. So that even that is figuring out how many people you need to cover well, just to scale it, to manage it. Um, these are all decisions you have to make. But at the end of the day, well, let's talk about results. Like, so how much can this really move the needle? Like, let's say if somebody's listening patiently, like, yeah, but does this any of this even really matter? Like, what kinds of increases are possible when you start getting a hold of this? Can you double a business this way? Can you grow by 5%? Like, what are some fun, maybe you have a fun success story, I don't know, but just like what are the results? What are we trying to get?
Yeah. It's there's a lot of variables that come into that, but I'm going back to data again because data drives the front end of this. It tells you what the possibility it is. It tells you what you can earn. It also sometimes can tell you how quickly you're going to be able to move that. So I'll just use my example when I was talking the splitter things.
Yeah.
If I'm going after business that's highly aligned with a competitor, that will take longer than perhaps those that give me some and I want to get more. So it's looking at, it's my best example is like, it's looking at, well, what business can I earn? How easy is it going to be for me to get it? Because we've all said it, we all know it. There's not usually in many markets anymore any low hanging fruit. It's all been picked. So that's a piece of how you determine how quickly you can do something. But sometimes the best way of looking at this is, and I'll just use our orthopedic example. If I can get 5 new XYZ surgeries, what are those worth to the organization? And how does that pay the salary? Like what pays for this? It's very easy to calculate that. How many do I need to bring in order to be able to pay for this? And of course, it's got to do more than pay for it. So that's usually where that looks like. The reason pilots come in is when we're unsure. It's like we're really unsure of what the true potential is. How hard is it going to be to move it? So before you invest in a lot of talent, hiring talent, which is not easy, okay, which we already talked about. But before you invest in that, put somebody out there for where your greatest opportunity is, get the right talent, and let's see what can happen. So there are ways to ease into this without making a big investment to be able to see what your results will be over a shorter period of time. Does that make sense?
Sure. The pilot thing certainly is going to go well with a lot of the people that I work with. They like the idea of pilots, right? Because they're not putting their reputation on the line and millions of dollars on the line. It's like,
Yeah.
let's try this. Although you're the expert on this, but broadly speaking, anytime I get into something like this, I'd prefer two salespeople because the variation and ability of salespeople varies a lot, and it's really hard to tell. Even the best sales managers, it's hard for them to um, spot talent and motivation, right? It's about 50-50. So to me, I'd probably spread my risk out by maybe hiring a couple people if I can, if I got the budget for it. So backing up to big picture, like, we've talked about a lot of things here, but what strategies broadly bring the greatest result? Like, what are the really key variables that really matter to bring the best results?
Well, okay, so from a there's probably we have what we would call 9 best practices in this referral development space. I won't give you all 9 of them right now, but I'm going to pull out the ones that to me make the biggest difference. Okay. Data driven, which we've already talked about, like anything that can drive who you're targeting, what's your opportunity to get, all of, like I said, how easy is it going to be able to get it? Like, what can I earn? Okay. So that's one. Okay. The other is we've also talked about, and that is differentiation. Okay. I think we've been talking about differentiation, and I'm a marketer. Okay. We know differentiation in this space of referral development. I think we've sort of, oh, yeah, 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 I get that. And anymore, if I want to change a referral pattern, I got to get pretty nichey on why me versus somebody else, including when somebody even wants to recruit a specialist or something. What do they do that's different? How is that going to help me compete in my marketplace? All of that plays into it. So differentiation, talent. We talked about it. Okay. This is an expensive strategy because it is 100% talent driven. If I don't have the right person in the field, I can have the best data, I can have the best surgeons, but if I don't have the right person in the field, I won't get the return on investment. So that talent piece is an important one. And then I'm going to just grab the last one. I might even throw one little one in here at the end, but the last one is, am I tracking and keeping track of all of that? Because I will tell you, in these larger multi-specialty type practices, it's the piece that challenges them the most. Like hospitals and health systems, exact same thing. They have no idea where the referral comes from, and that's very challenging. I will tell you, a multi-specialty practice, you can do it. You can see exactly where that referral came from and connect that referral to the activity that that person had in the field, that field rep had in the field, and you can begin to make correlation between how many visits it takes, what those conversations need to be like, how long it takes before I actually see the first referral. What is it worth in the long run in terms of ROI down the road, that relationship as you build it? I mean, they're all full of it. So it's to me, it's vital that you put that in place because it tells you what works and it tells you what doesn't, which doesn't mean that the program didn't work or that the strategy didn't work. It just usually means you need to tweak.
Great.
So yeah.
That makes sense. That was great. Um, as we were not quite at the end, but as we begin to start circling towards the end, the just a comment or two about access. I mean, first of all, doctors were overwhelmed before COVID. COVID gave a lot of groups the convenient excuse, we just don't see people anymore ever. So that's going to be more challenging. But uh, any other special insights besides, yeah, it's brutal, and for getting access?
Um, yes, you're right. It's real. And I don't think we have talked to a hospital, health system, or anybody that doesn't have an access issue. In fact, you can differentiate if you don't. Um, Most of the access, though, are on all those areas that we just know. Like if you want to try to get an appointment with a neurologist, it's going to be rough. For an endocrinologist, it's going to be rough. So access is real. Here's the other side of access that goes to my niche piece of it. I'm getting really nichey.
Yeah.
Um, it's like, what procedures, what am I looking for? What is the patient that I will have access for? So in other words, I'm not growing cardiology or I'm not growing orthopedics. I'm getting pretty nichey on the ones that I absolutely want. And that's where this talent piece comes in, because I'm going to have a conversation in the office about that patient need versus all of your orthopedic needs.
That makes
Um,
sense.
yeah.
Because it's also a compelling way to get in the door. So there's access in two ways here, right? There's access in terms of do we have access to take care of the patient. The
Right.
other way of looking at it is access to get into meet the doctor. Two
Yep.
different, very different concepts. But having something specific helps really with both, right? Like you've got from your
100%.
side, your doctors have, will make room on their schedule for a big surgery, for example. And getting in is something special to talk to the primary care doctor or whomever about is really important. Um, you know, the I guess the last thing we can talk about today, because we've covered the other questions we prepped here, would be, steps in creating the referral development program. We talked about data, we've talked about a pilot. Any other things that you think are like really critical things for them to think about as they begin thinking about creating a program like this?
So the only one we probably really didn't talk about is what I would call internal buy-in, so that you've got specialists that are hungry for the volume. You've got processes in place that make it easier for a referral to happen. What's the relationship your specialists have with the referring physician? Like, we didn't talk about how important, like, what do referring physicians want? I think we know the basics. Take good care of my patient and make it easy for me to make the referral. But the whole other piece that's in the relationship with that specialist is, what's that communication like? How do I want to be continue to be involved in the relationship while I've made the referral with my patient? When do I expect you to communicate and what back to me? All of that can make and build really strong relationships. When I think about the specialist, boy, that's a differentiator from a referring physician standpoint. So those are the ones to me we haven't talked about that can really make a difference in growing some business. So when I think of large groups, I'm like, so what's your strategy for how you're what's your experience going to be for the referring physician when they work with you or any of your specialists?
It's so
So
fun talking about this because back in the days when I used to fly around the country leading seminars on growing practices, it's been a long time now, but we would teach a section on doctor referral bidding, and those exact same things 20 years ago we would talk about. But then we were talking to the individual providers on how they could do this themselves, right? And so now it's like, well, doctors would say, well, first of all, I don't have time, but number two, I became a doctor, so I don't have to be a salesperson. But it is funny, like what I have found is in any group with say 10 or 20 doctors, one or two are just naturally good at all this.
yeah.
And some of them like are really busy with the best cases because they make time. They actually stop by and meet referring doctors once in a while on the way into the office, and they do all these things well, either purposefully or they sort of stumble into it. And it's a decided difference in results. Like one doctor could stand out far above everybody else because they just do this stuff. But that doesn't scale, right? So you can't, because in the old days, the method is teach all your doctors how to do this. And yeah, how many of them will actually do it? So that's where the idea of scaling, which is so important and um, as deeper than we have time to go in the day. But for sure, anybody that we work with would want to know, how do I scale? How do I do this across my 50, 100, 200, whatever number of locations? So last two questions. One is, okay, obviously you're a consultant in this, and that's what you do. If somebody wanted to, I'll give you a sort of a 30-second message here of like, like, do you usually recommend like an assessment as a first step? How does that look? Like, how does that work if we wanted to, talk to Susan and her team?
Yeah, if somebody, we do a lot of assessments, mostly when there are organizations that say, okay, I have some people doing this. Um, we're going to, here's the line usually, we will be expanding over the next 2 to 3 years, and I need to get this team performing at the upper level, or all of that. So that's where a lot of assessment comes in, when they have something in place. The second part of assessment is they don't have anything in place, or maybe they've got one person who's kind of doing it part-time. And they know they need it, or they think it's an opportunity, like they want to grow their business, and how do they do that? The assessment comes on the other side that says, what's the potential in the market to grow?
Yeah.
Um, so that's sometimes where pilots come in, where it's like, okay, it takes a lot of listening, a lot of reviewing, of understanding their market, understanding where referrals are coming from today, understanding the competition in their market, everything from, like I said, differentiation, like what's it going to take to earn the referrals. And that sometimes in those cases is where that pilot comes in. It's like, okay, let's put a person out there before you hire somebody, because there's ways to do this. We have ways in which we've done this with teams. And that's where you start. And then based on those results, then you figure out how to scale, and take it from there. Yeah.
Right. So the last thing we can talk about is, um, you and I have been talking a lot about lately how our agency will do digital marketing to reach HCPs, healthcare professionals, doctors, PAs, NPs, or whomever on a one-on-one basis online. And as I hoped you were like really excited about that. Tell me about like, how helpful would that be to, physician liaisons in the field trying to, establish relationships when they're already much more familiar with you based upon other marketing directly to the doctor as that air war to support the ground troops, as they, so to speak.
I am a firm believer that you got to do both. Because just like we've talked about today, all on the sales side of this, and having that field rep have responsibility for conversations with referral sources, and data's driving who do I have an opportunity to earn from. There's usually a whole bunch more that I want to go, well, that's expensive for me to go after them. So what can I do on the digital side to create awareness, to create interest, to create a relationship digitally that just begins to move them from, like, I'm going to nurture them into, okay, now let's have a conversation with them. I most do one or the other, but not both. And to me, they work really well when both go together, because there's a whole market usually out there that doesn't make sense to have a field rep calling on because it's expensive. But can I move them into where now it's time for them to have that conversation? I
Very
think there's,
good.
yeah.
So we're going to post your contact info on the webpage, but for the people that are listening just audio on a podcast, how do they reach you, Susan? What's the best way to reach you?
Easiest way is email, and that is Boydell, Boydell, because I think you can see my name on the thing, at barlowmccarthy.com. Or you can just go to info@barlowmccarthy.com, and they'll get it right to me. So either one, they work.
All right, great. All right, awesome. Well, that was fun today. Thank you, Susan, for attending. And this area we're talking about is something our agency does a lot in, and we'll probably be working together on assignments, ongoing into the future. So good seeing you again.
Same here.